Prior to this pandemic, we still had a lot of problems with healthcare, health insurance, the price of caring for your own health in this country, and a big one that have received quite a bit of focus over the past few years was the ever-increasing price of insulin. Well, we now have some good news. Pharmaceutical manufacturer Eli Lilly said Tuesday that it will limit the out-of-pocket cost of insulin to $35 per month to offset financial hardships due to the coronavirus pandemic. The copay cap will cover the majority of the company's insulin under the Humalog injection and is open to the uninsured as well as commercially insured people, but not to Medicaid, Medicare, or Medicare Part D patients. I'm not sure exactly why that last part is there. And the thing is, like, look, taking totally just by itself, this is obviously a good thing for the people who have desperately needed financial support when it comes to paying for insulin before this, many of whom will be both in need of insulin and will have lost their jobs. But as a lot of people have pointed out when this news broke, it kind of seems like they could have done this before if they're doing it now. I don't know. I don't run the company, but it seems like the jacked up price was not being driven by actual financial concerns.
Yeah, certainly they could have been better than they have been. I don't know the numbers and where it could go in terms of how low it could go. And again, I mean, the medical business is what the medical business is, and so much of it nauseates me in the way that they do their pricing. So I don't know where it would come from, but I tend to think that if they can come down to 35, they could have come down to something more manageable for many Americans previously. And what does this mean after the pandemic? What does this mean going forward? And, you know, the other part of this is that so many of these drugs that are being tested right now, and it's not necessarily insulin, but diabetes patients are among those who are most vulnerable to COVID. So many of these drugs that are being tested are now in shorter supply for the people that need them because people are testing. We know that with malaria drugs. We know the people that are taking those malaria drugs that the president is sort of ballyhooing as kind of a cure-all for the coronavirus and COVID. They're going to be at a shortage pretty soon, and that's scary to a lot of them. So this whole idea of supply and demand is a big part of this as well. It definitely does mean that this price could have come lower long ago, and when this pandemic is over, it should be lower than it was when this started.
Yeah. And to give some historical perspective on the rise in the price, insulin prices spiked nearly 100% between 2012 and 2016, often costing thousands of dollars, even for insured people with high deductible plans. No, that's 2016. We know that it didn't stop then, obviously. The price has continued to rise, and I have never seen presented any sort of feasible reason based in access to materials needed for its construction, relicensing. I haven't seen literally anything that has explained why it's more expensive now than it was a couple of years ago. And to go back even further in history, in 1923, the discoverers of insulin sold its patent for $1, hoping the low price would keep the essential treatment available to everyone who needed it. Reached for comment, those discoverers are spinning rapidly in their graves. Because that was a great plan, but unfortunately, people who are incredibly shady have gotten control over it. And I think it was Shkreli, one of the worst people of the past few years in public life, who I believe that's one of the drugs that he massively increased the price of. So look, it's good that they're doing this. As a skeptic, I'm inclined to believe that perhaps it's a brief PR move, and I wonder how long it'll last. But if you need this, and people have died recently in the past few years because of not having access to the money needed to pay for the ever-increasing price. That shouldn't be happening. And as I think it was Eric Wall pointed out, it's cheaper than 35. Free is cheaper. And for something that you need to sustain your life, especially if you are already paying for your insurance, the idea that you should suffer more financial stress it's not comprehensible to a lot of Americans.
Yeah, and it's different than sort of like the temporary rent relief, right? That you can have landlords not charge rent for 3 months or whatever it is. That's different because those are people that own property that make a living off of this. But when you look at what the drug companies are doing, it's a totally different thing. If they can come down for 3 months, they can certainly come down with some degree of permanence because they have to. It's an obligation, and they're making enough money anyway.
Yeah, and I would just add this to the list of like all of the things that to progressives seemed like solutions that needed to happen before the pandemic. There are things that are starting to happen during the pandemic, or that people are starting to realize during the pandemic. And I hope that once it's done, once you're not in quarantine, you don't think about coronavirus, I hope that people don't go back to sleep effectively on this. Like, I think people are realizing some of the fundamental flaws in the way that healthcare is provided and paid for in this country. And it could be solved not just under emergency conditions, but going forward during all of the other emergencies that we don't treat as such. For more political news breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/The Damage Report. And you can ring the bell wherever it is so you don't miss anything.